So what happens in conduction block? There are 3 grades of conduction block. One is the first degree block, second degree block and third degree block. So let's see what happens in each of them. First, coming to the first degree conduction block. First degree conduction block. This name, I would say that it is actually a misnomer, because here there is not actually a block. Let's see what happens here. Conduction block. Conduction block means wherever the AV node is conducting to the ventricles, there is some block in this pathway. That's why it is called conduction block. But what happens in the first degree? The first degree, there is just prolongation of PR interval. There is no conduction block actually, but still the PR interval is prolonging. So they are considering there is some conduction delay. Instead of block, we can use the term delay. So what happens here? There is PR interval prolongation. As you can see in the representative diagrams, we have drawn an elongated PR interval. So this PR prolongation is happening. Now you guys are going to tell me what is the normal duration of PR interval. Normal duration is around 3 squares to 4 squares. Now if it is prolonged more than 5 squares, it is called as PR interval prolongation. The duration is 0.20 seconds. So that is the PR interval prolongation, which is also referred as first degree hot block. Now coming to the second degree hot block. In second degree hot block, they are further classified into two types. The second degree hot block. So the first classification for the second degree hot block is called as Mobitz type 1. It is called as, what is called as Mobitz type 1. Mobitz type 1. And the second one obviously will be called as Mobitz type 2. Mobitz type 2. So this Mobitz type 1, it is also called as Wenckebach phenomena. Let's try to understand what happens here. First, this is also called as Wenckebach phenomena. What is the phenomena? This is very, very important. Wenckebach phenomenon. What happens here? See this diagram and tell me. Let's keep on. In conduction block, obviously we will be looking at the PR interval duration. So what is happening to the PR interval? See here. This is the second PR interval and this is the third PR interval. And this is the fourth one. So what has happened here? The PR interval is consecutively, it is prolonging. It is prolonging and finally there is no QRS complex at all. Like one QRS complex is dropped. So what has happened here is the PR interval prolongs. It is keeping on prolonging. Finally, it is not conducting one beat at all. The PR interval prolongs followed by a drop in QRS complex. Drop in QRS complex. So there should be a prolonging in every beat and finally a QRS should be dropped. Only whenever there is a prolongation, it is first degree. If it is prolonging and dropping, it is the Mobitz type 1 or the Wenckebach phenomena or the second degree hot block. The second type in Mobitz type 2 is there is not as such PR interval prolongation. Keep on, it is increasing. That phenomena will not be seen. But suddenly a QRS complex will be dropped. For example, there are many varieties in this like 3:2, 2:1, something like that. Okay. For every 3 P waves, we are getting only 2 QRS complexes. Or every 2 P waves, we are getting only 1 QRS complex. So this type of block is called as Mobitz type 2. Here there is no consecutive prolongation of the PR interval. Here PR interval has the same interval and suddenly 1 QRS will be gone. So that is the difference here. PR interval, same, it will be there. Suddenly one drop in QRS complex. This drop can happen at any time. But the above in type 1, the PR interval should keep on prolonging. Like the distance should increase, then drop should happen. Now coming to the third type, that is the third degree hot block. It is pretty simple, third degree hot block. What is happening here is, here the AV node is not conducting anything to that of the ventricles. So the AV node is not functional at all. So it is a complete block. Third degree hot block is also called as a complete hot block. It is also called as complete hot block. So what will happen? All of us know from our basic knowledge itself, like every area has their intrinsic ability to beat. Now AV node is not conducting. So what will happen to the Purkinje and the ventricular muscle? They will start beating there at their own pace. What is their pace? It is around 20 to 40. But atria is still receiving the SA node impulses. So what will happen? The atrial rate, the atria will be beating at a separate rate. The ventricle will be beating at a separate rate. So what will happen? You will just find many multiple P waves, suddenly a QRS complex. Multiple P waves can come, suddenly a QRS complex. This pattern can keep on repeating. It will not be very pretty much sure like how many P intervals P waves will be followed by a QRS complex. It will be random because atria is beating separately, ventricle is beating separately now. So the atria is having separate beats. Atria beats separately and ventricle beats at their own rate. Ventricle beats at their own rate. So this type of ventricular beating, where it is beating on their own rate, it is also called as idioventricular rhythm. So what is the name for it? It is also called as idioventricular rhythm. The ventricle is beating on its own. So this is all about the different types of conduction blocks. So first degree, second degree, and third degree. So coming to the myocardial infarction. All of us know myocardial infarction. They will give an ECG image, and finally there will be an ST segment elevation. So if it is an acute MI, there is an ST segment elevation. So this will be there, but right now they are not worried about finding the ST segment elevation. They want us to identify which side of the heart is affected, whether the anterior wall or the inferior wall or the lateral wall, which side is affected. So just we have to know the positions of our ECG lead. So what all leads are located on the lateral side? Lead 1's direction is this. So lead 1 is there, and V5, V6. All three leads, whenever there is an XT segment elevation in these three leads, then it is called as a lateral wall MI. It is called as lateral wall MI. Then what are the leads which are looking inferiorly? What are the leads which are looking inferiorly? Inferiorly, we have the lead 2, lead 3 and AVF. AVF for the foot. So this 3 indicates inferior wall MI. Inferior wall MI. Then the lead V1 and V2, they are located in the anterior side of the heart. So it is called as anterior MI. Anterior wall MI. The ST segment elevation will be seen in this particular leads. Then coming to V3 and V4, finally, they are anteroseptal, both the anterior part as well as the septum of the myocardium, septal MI. So these things we have to know. It is pretty logical. It is depends on the location of the particular lead. So with this, you have to remember all this leads also.